So we're here with Dr. Stephen Penny, orthopedic surgeon and editor-in-chief of footeducation.com. I have a few questions regarding ganglion cysts, so I'll start off with my first question. What is a ganglion cyst?
Well, it's a fluid-filled sac, and it originates from one of the joints in the foot or the hand, and it leads to a lump or a bump on the top of the foot or around the ankle or around the wrist area. Those are the common areas. It ends up being soft and rubbery.
Is it painful?
Most of the time it's not painful. It can be uncomfortable if it's rubbing up against a stiff shoe or anything that puts pressure on it, but generally it's not painful.
Okay, so say I did have a ganglion cyst, how could I go about getting treatment? I mean, what would be the first step?
Well, the first step would be to address any symptoms that it causes, and so just being careful with your shoe wear and putting padding around it is usually all that it takes to control your symptoms. And it's not uncommon over time for the ganglion itself to decrease in size. Some of them do require surgery, and when that occurs, we'll actually remove the cyst itself. It's not too painful. I mean, it is surgery, but we're not operating on bone, so you will get some swelling and discomfort. It's just like having a cut on your foot. But it does limit your activities for a number of weeks after the surgery.
Okay, how many weeks? Like, are we looking at a month or?
Yeah, you're going to want to slow things down for probably the better part of a month, and patients that sort of push it right after surgery can get into a bit of trouble with wound healing and other potential issues.
Okay, and then, you know, I'm a bit of a worrywart, so what could possibly go wrong with that surgery?
Well, there's a saying that there's no operation that's ever been invented that can't conceivably make you worse off. And that's really a way of saying, although it's unlikely, you could get a complication. And the things that we worry about with a ganglion cyst are generally wound healing problems, because patients can often get going fairly quickly. They'll often have a little more swelling to that area, and on occasion the wound might break open, and so we worry about that, and you could get an infection. But the other thing is it could also recur. And that happens on occasion as well.
And if it did recur, then would I just have another surgery, or?
Well, we would treat it the same way in terms of trying to get it to manage non-operatively, and if it did recur and was significantly symptomatic, it might require another surgery. And fortunately, that's relatively uncommon, but it does happen.
Okay, well, thank you so much, Dr. Penny, for your time.
Thank you.